This program started 40 years ago. It was to meet the needs of those who were coming to Blessing Hospital for service that were sort of falling between the cracks and didn't have a minister or pastor or a priest of their own.
There's been a lot of hospitals that have copied what we have here. To be involved in it, we need to give 10 hours a month. That's 2.5 hours a week on a normal 4-week basis. That's not bad. The rewarding thing is to see ministry done on behalf of God, regardless of race or religion or whatever. We walk into a room, we represent God in some facet, some understanding of what people have of God. And wherever it goes from there, it's sort of up to us and up to them.
It's happened to me on several occasions. Someone has come back and said, after several weeks or months or even years, and said, I remember you came and talked to me, you prayed for me, and I felt so much better. When you have things like that take place, those are very fulfilling moments, and I don't think you can get that by just going through simple routines.
The program, the chaplaincy program, is the most rewarding experience of my life. Being able to make a difference in our patients' lives. It's so important that we are there to support them because, let's face it, this is a totally different world.
The opportunity to meet people in their deepest, darkest moments. That is both moments of joy, the celebration of being with a family when a child is born or just after they've been born, through the journey, life's most critical times, and even in moments of death, watching people, being with them, being with their families and supporting them.
The most important thing is just to have a chance to serve and to minister, to be able to celebrate the joys when a child is born, and also just the tender ministry of being there when someone passes from this world into the next, and to be able to read the psalm and read John 14 and talk about the dwelling place in our Father's house, and to pray with them and pray the Lord's Prayer. I mean, they're very beautiful, tender times of ministry.
The ministry of chaplaincy here at the Blessing is so far-reaching into our community. The testimonies or the reports of how people have been ministered to and touched are far-reaching. It's one of those gems. We call this the Gem City. It is one of the gems of our community, is the chaplaincy program.
Well, let's be honest. When we're saying that we don't have time, about 9 times out of 10 what we mean is we don't want to be bothered. But it's the nature of this work that we do, it's the nature of the ministry to be bothered. It's inherent in the business. To be bothered with people who are in distress, who are facing sickness and death and grief and crisis of all sorts. This is what we do. This is ministry. This is what we're here for. And this offers you an opportunity to do it in a place and in a time when it's most desperately needed.
You can have time to do way more than what you think you have time to do if only you just focus for a moment. Instead of saying, I'm not going to do it, begin to say, how can I be a part of the team? How can I not have enough time to give 10 hours? Let me say it again, 10 hours. And, how can I not just find 10 hours?
Make time, because you don't know what you're missing. Because people are so valuable, and God opens up so many doors for you to be a blessing to people, And so I just always say we have more time than what we realize. We just don't always use it correctly.
They are here during some of the most difficult times of a patient's life. They're here to celebrate life. They're here to help us as a staff never lose sight of what is necessary for our patients in our beds. And they are quiet heroes in the organization. They pass through the hallways, sometimes going unnoticed, but doing such vital and important work.
Well, I think it's a very good program. I've enjoyed the spirit, the leadership of the staff, and the fact that the program has some character.
Well, I think this program is important to this hospital because I think the spiritual healing that we have is very important. You know, we hear a lot about the wonderful benefits of increased health care, but there's also the spiritual element. And the spiritual element of healing is very important, that they know that there is a God who loves them, that they know that they can be helped.
When I come and serve as an assistant chaplain, I leave feeling so blessed. I can come in feeling down and discouraged, and when I leave, I feel blessed.
Well, since I came on board with the chaplaincy program almost 4 years ago, it's been clear to me the necessity of this program here at this hospital and how unique we are in being able to provide such wonderful spiritual care to our community. I see new pastors coming in town all the time and wondering, do you know about our program? You know, have you been a chaplain before? Do you have experience that you could offer this community? And I see on a daily basis the people that it touches, people I interact with here in the chapel that can tell me what wonderful experience they had when the chaplain visited them, or even asking me for prayer, asking me to sit there and hold their hand and listen. When people are in the hospital, they are vulnerable and they are seeking someone to hold on to, someone to help guide them through this process. And the chaplaincy program offers that and so much more.
Blessing has had a tradition with their chaplaincy program for almost 40 years now. And I think no matter what a physician brings to the table, the most seasoned, the most educated, the most scientific-based physician practice recognizes that there's a spiritual element to healthcare. We provide that. Our multi-denominational chaplains come to us from the communities that we serve and bring their own brand of healing to the patients here at Blessing Hospital. It's an important part of what we do, the bedside healing, but that's not all that we do. Our chaplains serve our employees, they serve our volunteers, and they serve our community, and we appreciate what they do.
Well, if someone tells me, you know, I just don't think I'll know what to say, I would say join the club. It's important, I think, for the chaplain to be here as the presence of Christ. There are no words really that can console parents when they're standing by the bed of a child that has died. But it's important to be here, and I always read scripture to them, and I always pray and touch them. And I find that the prayer is very calming and very, very helpful. I pray for the peace of Christ upon the family, and I pray that the Lord will receive their child or their teenager into His everlasting arms.